And it's a pride to have Dr. Shail with us. He's a senior consultant at Raghudeep Eye Hospital, Ahmedabad, and an amazing surgeon and uh, extremely academic. And I think every word he talks will have an information and a pearl for us. And it's a pride to have you amidst us, Shail. And he's
Thank,
going to be talking on conquering soft cataracts. So let's
thank
hear.
you, ma'am. Thank you, ma'am. So, after all the talks on chopping, this should be a little change. Uh, we do receive research grant support from Alcon Laboratories. So, these are the kind of cataracts that we are looking at. So, they are not in their 20s and 30s. They are in their late 40s, 50s, or even 60s, where the nucleus is not very dense. It's practically clear. But they have these either posterior cortical cataracts or posterior subcapsular cataracts with not much of a dense nucleus. And although the patient is more visually disturbed by these cataracts than the nuclear cataracts, quite often these are the cataracts that cause more difficulty to us intraoperatively than the actual very dense cataracts. So we really need a surgical strategy that is safe, effective, and predictable. The biggest problem in soft cataract is in some cataracts something works, in some cataracts something else works. So normally what you start off with is typically to doing a smallish capsular X's in routine situations. In a soft cataract, maybe if at all you may end up doing a slightly, you might want to end up doing a slightly larger than a normal rhexis, so that in case you find difficulty or a bowl creation occurs, there's more easier chance of prolapsing the nucleus out. Normally, this is what I would do alone. That is only hydrodissection, and hydrodelineation is something which I don't routinely do in any of the normal cataracts. But sometimes in very soft cataracts, I do believe doing a hydrodelineation may help to create some at least central zone of denser nucleus, the typical golden ring sign that we see, which will allow us to make use of the very small
Arul, you have to mute yourself. Arul, you have to mute yourself.
So quite often
Arul, can you mute yourself? Yeah.
Sometimes these very soft cataracts, it's only this very small central nucleus which is actually dense and which can have a hold. And therefore, in a normal case, I would always do a trench first, like Dr. Ramamurthy said. But in some of these cases where I know young myopes, where only a very small nucleus hold might be there, I go for a direct chop, so that whatever that little bulk of central hardness of that nucleus is there, I can, occlude that and at least create 2 or 3 chops, so that even if I then fail to create further chops, at least I have 2, 3 fragments which I can handle. But like we've all know, chopping doesn't work in many of these cases. Like in this case, it's a fairly myopic eye. I'm struggling. I've done sculpting. It doesn't divide. Then I'm trying to again sculpt to make it thinner so that at least I can laterally separate and divide. But sometimes none of these techniques tend to work predictably or effectively because you don't get a hold. And then you end up typically in a bowl kind of a situation where you neither have left anything to chop for yourself, you have neither left anything to sculpt and divide for yourself. And that is something which does occur, particularly when all of us are, very steadfast chop surgeons. We want to chop everything. So in a very soft cataract, I think the 4 quadrant technique or the divide and conquer is something I go back to, because that allows us to thin out the central nucleus in all 4 quadrants, so that even if it doesn't physically divide, it will still then prolapse out, tumble out and come out. Otherwise, it won't even tumble out. The fear in sculpting in a very soft cataract is that you may go through and through the nucleus and you may end up catching the capsule, and therefore use a very, very low flow rate of 14 to 16 cc per minute and a very low ultrasound power of 20 to 30%. So keep your setting only very low so that even if you go full pedal, you are not going to end up eating up the nucleus very high, and a low bottle height. So this is what I mean. I've set an oscil of only 20% in this case because it's a softish cataract. And I do a traditional normal sculpt, and then I go even below the rhexis. You have to be conscious about the depth, but I go even below the rhexis to create a long 4 quadrants so that I'm creating enough thinning all around. And because my flow rate is very low, I'm not very worried that even if I go through and through in some part, I'm very unlikely to catch the posterior capsule. So go ahead, keep thinning more in the center than in the periphery. So center and mid periphery is something that you want to make sure is very thin, so that even if it doesn't kind of, divide completely, if it's not hard enough to divide, you'll at least be able to, tumble them out because they've now become very thin at the very base. During fragment removal, again, we want to be careful that we don't use a very high power, because if you end up trying to use a lot of high power, you won't get a hold on it. So if you have been able to divide like this in a 4-quadrant, what you can then do is, again, you may have a slightly higher power than what you did for your division, but not more than 30 or so, because you hardly ever need anything more than that. And a vacuum, not very high, because I don't want to, go through and through again through a soft nucleus. So I keep a vacuum of around 300 to 350, and a flow rate of 20 to 25 cc per minute. And the other thing that helps is keep everything in the center, so that the iris also doesn't misbehave. A fluid doesn't keep going back, and there's no iris prolapse, which you saw in that case previously, where I struggled to chop. So keeping your parameters low and doing a 4-quadrant technique, I think, is my standard to go. When I see in the OR list that this is a grade 1 or a grade 2 cataract, I don't even attempt a chop in some of these cases, and keep a very moderate vacuum and a moderate flow rate. And if you have access to flags, I think these are the cases where we like to do the cylindrical lens division pattern, which means this will act as multiple hydro delineations, so as to say. And because these are now very soft cataracts and multiple hydro delineations have been done, therefore it's easier to kind of even aspirate them en masse
Okay, time
in,
up.
in these cases. So these are some of the things that I find very useful as far as soft cataract emulsification goes. Modify your approach. Don't stick to the same old chopping. Be flexible. Go back to 4-quadrant. 4-quadrant will work in anything where nothing works. So 4-quadrant should always be mastered, and that's something that's your go back to technique. And use low parameters, particularly in soft cataracts, so that you don't have the fear of going through and catching the posterior capsule. Thank you so much for the patient listening.
Wonderful tips, Shail, and definitely there is, all of us will keep these points very much in our mind. Going back to Dr. Titya, no, Shrish, what would you do, Shrish, if you have been operating on a soft cataract and then there is this bowel formation which Shail was talking about? How would you handle it?
Yeah, Dr. Shail has mentioned all the techniques of managing soft cataracts, and he has even mentioned above the age of 40, you have some formed nucleus, and below 30 years of age, there will be hardly any nucleus. So in such cases, just aspiration, irrigation aspiration or phaco aspiration itself is sufficient. But if the patient's age is around 40, 45, and there will be some formed nucleus in the center, and you can do either a hydro delamination or even a mechanical delamination without hydro procedure, and you can delineate the nucleus, and you can crack the nucleus right in the center. You will have some formed nucleus, and you can crack the nucleus and do whatever the technique you are comfortable with. And then the epinuclear bowl can be aspirated easily, either with the irrigation and aspiration. And this works very well.
And as far as refractive lens exchange is concerned, Dr. Ramuti, what would be your technique?
I mean, what Shail said was all relevant. Usually, we are doing refractive lens exchange only for patients in above their 50, who are in their 50s, and usually hyperopic patients. And these, as was mentioned both by Shrish and Shail, they will have some form nucleus. So I go back to my normal technique, that is, make a small trench, try to bury the nucleus into the tip into the substance of the nucleus, and create a chop. Just in case I'm not getting it hold and it's too soft, all I do is to extend the trench and make it a full length trench from 6 to 12 o'clock. Then going with 2 Sinskey hooks, it's just my own modified way, and crack the nucleus into 2 halves. So whether it's a hard nucleus or a soft nucleus, I find that this stop and chop works well. And once you have broken the backbone of the nucleus, then you are able to take it out quite adequately. One point I want to emphasize is that all of us talk about adequate size rexes, 5.5 millimeter rexes in hard cataracts. But I think it's equally important in soft cataracts also, especially the very soft cataracts where if you have a 5 millimeter or 5.25 millimeter rexes and do a good hydrodissection, the entire lens material seems to pop out as a pulp or has this salute sign where it stands up. In that case, you just go ahead with your quadrant removal settings and aspirate the entire nucleus using hardly any phaco power.
Tamal, you have any question?
My question is to Dr. Shail only. I also never chop, but I try to do a stop and chop. When you do a divide and conquer, do you think that the surface area of your wall of the trench becomes very small and is difficult to crack, divide and conquer in soft cataracts?
Not really. I think like any 4-quadrant technique, I mean, we don't want to make a very wide trench, of course. I usually don't widen the trench very much. I just use the one width of the phaco probe, which I find is sufficient enough to put both my instruments in the wall and divide. So I don't really make a very wide trench. I don't think that's very necessary.
Thank you.